Welcome everyone to the statewide Medicaid Managed Care Long-Term Care Program webinar for long-term care potential network providers. This presentation is part of a series designed to teach you about the statewide Medicaid Managed Care Long-Term Care Program. In particular, today's presentation will cover material on home and community-based characteristics, home-like environment, and community integration for Medicaid recipients in assisted living facilities and adult family care homes. Let me introduce you to today's presenters. We have Wendy Smith with the Agency for Healthcare Administration and Cheryl Young, Bureau Chief of Long-Term Care and Support Services, Department of Elder Affairs. I'll now hand you over to Wendy.
Thank you, Danielle. Good morning. My name is Wendy Smith, and I am with the Agency for Healthcare Administration, Division of Medicaid. And first, I would like to direct you to the Centers for Medicare and Medicaid Services proposed rule on slide 7. This is the rule that the Centers for Medicare and Medicaid Services placed on the Federal Register at CMS.2249-P2 that was published most recently in the Federal Register on May 3rd, 2012. And on the third bullet, we've provided the link so that you can look at the proposed rule that describes home-like environment and community integration. This rule requires providers that serve Medicaid recipients in the community maintain home and community-based characteristics, which includes person-centered services and a home-like environment. Slide number 8. The programs that are affected by the proposed rule, all Medicaid waiver programs providing services in assisted living facilities and adult family care homes are expected to provide a home-like environment and community integration to the fullest extent possible. And this includes the nursing home diversion waiver, the assisted living waiver, the channeling waiver, and aged and disabled adult waiver as it relates to facility-based respite services. Also, this relates to the long-term care statewide Medicaid managed care waiver and any other Medicaid waiver program that offers services in assisted living facilities. Slide number 9, Medicaid home and community-based services waivers. Medicaid HCBS waivers provide funding for services for Medicaid-eligible people with qualifying disabilities who want to live at home or in the community. HCBS waivers allow state Medicaid programs to cover services traditionally viewed as long-term care and provide them in a community setting to individuals rather than a nursing home or another institution. Slide number 10. Medicaid home and community-based service waivers eligibility. In order to be eligible for HCBS waivers, recipients must meet the medical criteria or institutional level of care. They must also meet Medicaid Institutional Care Program or ICP income and asset limits. They must satisfy any additional impairment criteria of a particular waiver, and they must be willing to accept waiver services instead of institutional placement. Slide number 11. Defining characteristics of a home-like environment. Each resident of an assisted living facility or adult family care home must be assured privacy in sleeping and personal living areas. Entrance doors must have locks. Residents must be able to have the key with, and only appropriate individual staff should have the keys to the doors. Individual residents must have the freedom to furnish or decorate their sleeping or personal care areas. They must have a choice of private or semi-private rooms, and if they have a semi-private room, they should be able to choose their roommate. They need to be able to have access to telephone service without restrictions on the length of use, and they must have freedom to engage in private communications of individuals of their choice at any time. Slide number 12, defining characteristics of a home-like environment continued. Individuals must have the freedom to control their daily activities and their daily schedule as their physical and mental conditions permit. They need to have visiting options of the resident's choosing. In other words, there should not be a restriction in the facility on visitation hours. They need to be able to have access to food and preparation areas in the facility at any time as their physical and mental conditions permit. They should be able to set their own sleeping schedule. Individuals should be able to participate in facility and community activities of their choice. And facilities should ensure that residents are allowed to participate in any unscheduled activities that a resident would choose. Community integration. It's important that access to the greater community be facilitated by the assisted living facility or the adult family care home based on the resident's abilities, needs, and preferences. The assisted living facility or adult family care home setting must offer meaningful community participation opportunities for the residents at times, frequencies, and with persons of their choosing. And on this slide, we have provided an example of a resident who wishes to go to the senior center and participate in the social activities at the senior center, but the resident does not have access to transportation. The Centers for Medicare and Medicaid Services does expect that the waiver case manager will work with the assisted living facility or the adult family care home to ensure that transportation is arranged and that the resident is dressed and ready to depart and able to go to their activities at the senior center. Slide 14, person-centered care planning. This is a very important process. The basis of any successful home and community-based setting is the creation of an individualized and inclusive person-centered plan of care that addresses services, supports, and goals based on the resident's preferences. The person-centered plan of care is based on a comprehensive assessment that includes resident and participation by any other individual that the resident wants to have participate in the development of their plan of care. The plan of care must support the resident's needs in the most integrated community setting possible, and the waiver recipient's plan of care must include personal preferences, choices, and goals to achieve personal outcomes. And this includes their own personal goals. Although we have had a history of sometimes developing plans of care that focus on just medical services or waiver services, the Centers for Medicare and Medicaid Services are expecting us to include an individual's personal goal. Slide number 15, personal goals. Examples of personal goals a resident may choose are deciding where and with whom they want to live, making decisions regarding their supports and services they receive, choosing which activities are important to them, maintaining relationships with their families and friends in the community, and deciding how they want to spend each day. And at this point in the presentation, I'll turn this over to Cheryl Young.
Now that Wendy has described the home and community-based characteristics that are expected, I'm going to talk a little bit about the promotion of these characteristics. The promotion of home and community-based settings and community integration can occur through individualized person-centered care planning, goal planning activities, and the promotion of a home-like environment in assisted living facilities and adult family care homes. In order to accomplish this environment in our state, we have established some new state processes to ensure that assisted living facilities and adult family care homes serving Medicaid recipients maintain a home-like environment and provide community integration. The state will implement the following new processes. The Department of Elder Affairs has recently modified our contracts with all of the diversion, managed care organizations, and other qualified providers. These health plans are in turn required to amend their subcontracts with ALF by early May of 2013. so that the subcontracts reflect the new requirements. The diversion managed care organizations and other qualified providers will also be reviewing for these characteristics during their credentialing and re-credentialing of ALF providers. Additionally, all assisted living facilities participating in what's known as the AL waiver or any other waiver utilizing assisted living facilities must sign amended referral agreements and comply with the characteristics of a home-like environment and community integration by the end of June 2013 or early July. And the state staff are currently conducting on-site reviews of assisted living facilities to ensure that a home-like environment is present. Additionally, all the ALFs and adult family care homes participating in the new statewide Medicaid managed long-term care program must meet the home-like environment and community integration requirements before the go-live date in each region. And the go-live date is defined as the first date of enrollment in each region. And state staff are also conducting reviews of the assisted living facilities and adult family care homes participating in the statewide Medicaid managed long-term care program to ensure a home-like environment by region. This slide presents each of the regions and the enrollment effective date, or the go-live date. So, for example, in Region 7, the first area to go live, all of the assisted living facilities and adult family care homes participating in the networks, the managed care plans must demonstrate a home-like environment on or before August 1st, 2013. So if you are a provider, an ALF or adult family care home provider in these regions, please look at the enrollment effective date column to know your deadline for meeting these requirements. And the managed care organizations that will provide services in the new program will also be verifying during the credentialing and re-credentialing process that a home-like environment and community integration characteristics exist in the facilities that they intend to contract with. This slide talks about the remediation or correction that is required by the federal government on this topic. So if at any point a managed care organization discovers that an ALF or adult family care home is not maintaining a home-like environment or supporting full community integration, the managed care organization must report the finding to the state contract manager immediately. The managed care organization must additionally propose a remediation or correction within 3 business days of their discovery of the deficiency. When the transition to the long-term care Medicaid managed care waiver is completed, AHCA and DOEA will provide ongoing oversight and monitoring to ensure that managed care organizations contract only with assisted living facilities and adult family care homes, providing and supporting a home-like environment and community integration. These characteristics are necessary for Flora's participation in the waiver program. This slide is the first of 2 slides that provide the exact language that will need to go in the subcontracts and referral agreements that managed care organizations and other waiver providers have with ALFs and adult family care homes. This language must be inserted into each subcontract or referral agreement. First, assisted living facilities will support the enrollee's community inclusion and integration by working with the managed care organization's case manager and enrollee to facilitate the enrollee's personal goals and community activities. Second, additionally, waiver enrollees residing in assisted living facilities and adult family care homes must be offered services with the following options unless medical, physical, or cognitive impairments restrict or limit the exercise of these options. So the options include a choice of private or semi-private rooms, a roommate for semi-private rooms, the choice of a locked door to a living unit, access to telephone and unrestricted length of use, a choice of an eating schedule, and a choice of participation in facility and community activities. Must also include language stating the ability to have unlimited visitation and snacks as desired. And finally, the agreements must offer the ability to prepare snacks as desired and the ability to maintain a personal sleeping schedule. So we'll talk a little bit more about monitoring activities by the state that will be ongoing. Much of what we have discussed will be the initial activities required by managed care organizations and other waiver providers to comply with the waivers, and then ongoing monitoring will be required. It will include the state's oversight of care plan development and goal planning. This means the monitoring of resident case files by quality assurance team members. It also means the review of community integration goal planning documentation. It means the continual modification of referral agreements and an annual desk review of these agreements for inclusion of home-like environment and community integration language. It means that there will be a review of monthly provider network reports and managed care organization credentialing files. And finally, the state will provide ongoing on-site reviews of ALFs and adult family care homes. This slide lists the organizations that will be providing and serving as managed care plans for the new Medicaid managed care program. The individuals listed here are the provider network contacts for these organizations. So if you have a question about the topics we've discussed today or about signing a subcontract with these organizations, your contacts are listed here for you on slide 25. I believe this is our last slide, and it is a list of resources so that you can stay up to date on this topic and any other topic relating to statewide Medicaid managed care. The first bullet lets you know that your questions can always be emailed to flmedicaidmanagedcare@ahca.myflorida.com. The second bullet lets you know how to go to the website and get updates. I won't read that link. The third bullet is the same link, and be sure to click the tab for events and news, or news and events, to keep up with upcoming webinars and other news and events. And then finally, stay up to date to receive program updates by visiting the website through the following link. And then click Sign Up for Program Updates, the box on the right-hand side of the page.